Hi there, I'm Alex from the Medical News Bulletin, bringing you the biggest medical news of the week. Visit our website, www.medicalnewsbulletin.com, for daily updates. You can find the link at the bottom of the screen. Today, we will be talking about the daily iodine intake required for infants, how the Mediterranean diet can help proper heart function, the link between fatty acid consumption and Alzheimer's, the best time to eat proteins, and the link between dementia and depression. So let's get started. Newborn babies require not just many different types of nutrients, but also specific amounts of each. Because they're in a critical stage of growth and development, deficiency of any nutrient in their diet can have huge detrimental effects. Iodine, a mineral found in seafood, bread, and iodized salt, is essential for the production of thyroid hormones. These hormones are needed for proper bone and brain development and are also important for controlling metabolism. Because data on the daily dietary iodine requirements in infants is limited, Swiss researchers carried out a clinical study to determine what the recommended amount should be. Results show that infants between the ages of 2 and 5 months require a minimum daily iodine intake of 70 micrograms a day. Iodine intakes below this level may result in iodine depletion and eventually hypothyroidism. Dieting, it turns out, is more than just for weight loss. The Mediterranean diet, as its name would suggest, is a diet that mimics traditional diets in Mediterranean countries. This diet focuses on high consumption of vegetables and olive oil, moderate consumption of proteins, and low consumption of alcohol. A new US study shows that following the Mediterranean diet can help promote proper heart function. Those following the diet more closely had an increased left ventricle volume and higher ejection fraction, both which indicate a stronger and healthier heart. Together, this can help reduce the risk of heart disease. Alzheimer's disease is the most common form of dementia and affects 9.7% of adults over 70 in the United States. There's a great amount of evidence that suggests that supplementation with omega-3 polyunsaturated fatty acids is associated with a lowered risk for the development of Alzheimer's. A substance of special interest to researchers is DHA. DHA is an omega-3 fatty acid found in high levels in fish and algae oils. It accounts for 30 to 40% of all fatty acids found in our brains. A new study shows that lower blood levels of DHA are associated with greater levels of amyloid plaque formation, which is a hallmark of Alzheimer's disease. Higher levels of DHA are associated with higher brain volumes and even better nonverbal memory. Researchers suggest that increasing your consumption of DHA could help protect against the development of Alzheimer's. Is there a right or wrong time to be eating proteins? New research suggests yes. A new study has found that the way that you distribute your protein consumption throughout the day could impact your level of lean mass. Lean mass consists of everything in the body that is not fat. So lean mass includes bones, organs, muscles, and other tissues. And because muscles are built from proteins, it's important to ensure that you are consuming enough protein to build proper muscle mass. It turns out that the best way to boost your lean mass is to evenly distribute protein consumption. In comparison with concentrating your protein consumption into just one meal, the best way to increase lean mass is to have it evenly distributed throughout the day. Depression and dementia have a scary link, according to a Netherlands study. Results from a 10-year study have shown that steadily increasing depressive symptoms are associated with the risk of developing dementia. Researchers also suggest that depressive symptoms in older age could theoretically represent an early stage of dementia. Globally, 350 million people of all ages suffer from depression, so these results provide all the more reason to seek treatment for mental health. That's it for today. Thank you for joining the Medical News Bulletin. We hope you enjoyed hearing about the latest health news.